Chronic sinusitis is a common condition in which your nasal passages or sinuses are inflamed and swollen for at least 12 weeks or even more. Breathing through your nose might be difficult. The area around your eyes and face might feel swollen, and you might have facial pain or tenderness. Chronic sinusitis can be brought on by an infection, nasal polyps, or by a deviated nasal septum, and the condition can affect anyone at any age. The specialists at Lake, Ear, Nose, Throat, and Facial Plastic Surgery explain that if the traditional methods for treating sinusitis have failed, it may be time to ask about balloon sinuplasty.
I was suffering with sinus problems for about 6 years. I had constant headaches. My left side of my neck hurt all the time, and I was on probably a 6-week regimen of sinus infections with antibiotics. I had headaches all the time. I just had constant sinus infections, so I didn't want to go anywhere. I didn't even want to go to the beach. Nothing. I had a very bad sinus infection that was keeping me from doing anything. So I spoke with my general practitioner, and she recommended Dr. Friedman. And I came into the office, and we discussed the sinuplasty and that I was a candidate for it.
Balloon sinuplasty is a procedure that was developed about 7 or 8 years ago to open the sinuses in a minimally invasive way by placing a balloon into the openings of the sinuses, inflating the balloon much as we would an angioplasty of a blood vessel that gently opens the sinuses by fracturing the bones to provide a wider passageway for the sinuses to ventilate and drain properly. So balloon sinuplasty is indicated in somebody who has chronic sinus symptoms, who has some degree of sinus infection or narrowing of the sinus openings on a CAT scan, and who don't respond satisfactorily to medications. The balloon sinus dilation procedure can be done in the office as a standalone procedure, or it can be done in surgery in conjunction with other surgeries that we do at the same time, whether it be a deviated septum operation or something else that we do.
I was back at work within a day. I had my surgery on Wednesday. I went back to work on Friday. I'm able to go outside. If I want to go someplace, I go. I go to the stores. I'm able to enjoy going to the park with my grandchildren. And I'm very, very happy that I had this surgery.
For more information on this story, as well as links to the specialists at Lake, Ear, Nose, Throat, and Facial Plastic Surgery, please click on the Balloon Sinuplasty story link on our homepage at yourhometownhealth.com.